Speaking of Measure 110, the Oregon Health Authority's program manager for the measure just resigned, and not happily. The Lund Report just got a copy of their resignation letter, and it's pretty scathing, worth coverage, and worth your time. You can check it out right now on the lundreport.org. They have a link to the 4-page resignation letter with former Measure 110 implementation and program manager Angela Carter, a naturopathic physician. They resigned last month, and in their letter they wrote, "My working experience with the Oregon Health Authority has been one of the worst and most disheartening experiences of my life." They said they weren't given the authority to hire the number of staff members that the program needs in order to function, and that they and the staff all worked long hours, up to 90 hours a week. They wrote OHA leadership was maliciously negligent in its lack of support for program implementation and operations. OHA leadership disregarded and ignored my repeated, direct, and clear written and verbal requests that appropriate assistance, staffing, and resources. They said it was determined that the Measure 110 program actually needed about 45 staff members in order to fully function, and instead they had 7. They said that when they told the OHA that they would not be able to meet deadlines because of that low staffing, OHA retaliated, restricting them from communication and saying they damaged relationships and made Measure 110 program look bad to the public. They wrote, "I personally experienced sexual and disability harassment, transphobia, intimidation, silencing, and retaliation from OHA leadership on numerous occasions." Dr. Carter wrote that they approached HR about the problems, but that OHA obscured their reports from the civil rights complaint process, and eventually the stress got so bad that they went on medical leave last year. They said that they saw the program have some initial success with organizations getting more people into treatment, but they accuse OHA of trying to undermine Measure 110 altogether, writing, "OHA continues to under-resource the program, mismanagement relationships with community partners, and oversight and accountability council members, and withhold relevant and important information from the public." It has become readily apparent that OHA is not interested in working towards a resolution or repairing the harm done to the vulnerable communities Measure 110 is meant to serve. The Lund Report contacted OHA for a response. They were told, OHA appreciates Dr. Carter's hard work and dedication to the Measure 110 program and wishes Dr. Carter well going forward. You can check out the Lund Report's coverage for more details, including the lack of training that Dr. Carter says they were given when they were chosen to lead the program. It's on the lundreport.org.